So there's not a best age to do the surgery, but any plastic surgery should happen in a good health. And so if patients get a good health and a good diet, they could always do the surgery. But most of the requests that are happening in the middle age time, just because patients, they lose weight after pregnancies, or they were obese, in a teenager ages, and so that's why they're 30, 35, they ask to have it, the tummy reduced. But we got some patients that come at the menopause age to have the weight reduced to avoid immobilization in elderly age. So age makes a difference on the healing process, but if we instruct and guide the patients through the journey, they could have probably a slower healing, but they will not have a higher complication rate, because we teach them how to prevent problem, and we are a bit more careful with them. We look after them in a different way. But I think the main age of a patient goes through the journey in around 4 weeks' time. At the beginning, the tummy tuck, abdomen are really tight and with a long scar. It takes time to have the skin elasticity going back to normal and to don't be as firm as a stone. That's how the patients describe it. And so it takes around 3 months to get to normal, but massages could accelerate the process, and the scar fades slowly. In some patients, we could achieve a good fading in 6 weeks. In some others, we will need to wait a year time to have the fade of the scar. It depends, but we give patients some tips, some treatment, some creams that we could use to accelerate the outcome. But patients usually they get discharged from my care around 2 months after surgery. So the tummy tuck surgery lasts in theater around 2.5 hours, 2 hours to 3 hours. That's the average of the length of surgery, but the results last forever, because we remove a piece of the skin that is a big stick in the patient's body. And so it's difficult to have a recurrence. But unfortunately, if patients don't change their diet, they will need to redo liposuction sometimes. If they put a lot of weight on, that's obviously the fat get deposited in the same areas. And usually it's the waistline that need to be redone. I'm quite lucky, and the patient satisfaction in my clinic is really high. And this is a life-changing procedure. So usually patients, they are crying and they kiss me and buy me present. But recently I had an amazing result in cuddles from a patient that lost around 40 kilos before having the surgery with me. She had a young baby, and she started the journey with me. And we guide her through diet, exercise, and then surgery. And from a BMI of 34, she ended up to have a BMI of 13. So from a pathologic BMI, obesity weight, now she is super healthy and probably fitter than I am, with a lovely figure. Because if patients collaborate and lose weight before surgery, often the cosmetic result could be even better. We could tie up more, and we reduce complication rate, because it's less fat movement in their body. And the result of the surgery is on my Instagram profile, with a lot of hearts from my patient's card. So tummy tuck surgery costs vary a lot. It depends if we will need to repair the muscle of the patient, and if we need to do liposuction, And how long the surgery lasts in hospital. It depends on how big the patient is, how large is it, because some patients, it could be a bit more with a larger hip, so with a longer area to suture, so it could take me more time to do the surgery. And that's why price vary so much, and I always do personalized quotes, but it's not less than £10,000 if you want to keep a patient safe, because we pre-order the blood, we do some tests before it, and we pay a hospital that they could support if we got a PA complication or some other, bad complication. One patient in 2000 could have a bad problem. So if a patient is in hospital, we don't risk their life. If we do the surgery in the non-protected environment, we could risk to kill them. So it's better, I think, to pay a bit more to keep a patient safe and to keep our practice with a good patient satisfaction.